How did statin research change stroke prevention? Imagine a world where lowering cholesterol could significantly cut the chances of having a stroke. That's exactly what research on statins has shown us. Statins are drugs that mainly lower low-density lipoprotein cholesterol, often called bad cholesterol. When scientists studied their effects, they found that these medications could help prevent strokes caused by blockages in the brain's blood vessels. One major study called the SPARCL trial looked at patients who had already experienced a stroke or a transient ischemic attack, which is like a warning stroke. They gave some patients high doses of atorvastatin, a common statin, and found that these patients had about 25% fewer recurrent strokes. This was a big breakthrough because it proved that aggressive cholesterol lowering could prevent future strokes. It also showed that for every 40 milligrams per deciliter drop in LDL cholesterol, the risk of stroke decreased significantly. Statins work mainly by reducing the buildup of fatty plaques in arteries, which can block blood flow and cause ischemic strokes. But they also seem to have other helpful effects, like improving how blood vessels function and reducing inflammation. These additional benefits help explain why statins are so effective in stroke prevention. However, research also uncovered some risks. The same studies noted a small increase in the chance of bleeding in the brain, called hemorrhagic stroke, especially in people who had a history of bleeding strokes, were older, male, or had high blood pressure that was not well controlled. Despite this, the overall evidence shows that for most people, the benefits of taking statins to prevent ischemic strokes outweigh the small risk of bleeding. That's why doctors carefully assess each patient's individual risk factors before prescribing these medications. In recent years, scientists have explored combining statins with other cholesterol-lowering drugs like ezetimibe or PCSK9 inhibitors. These newer therapies can further lower LDL cholesterol and reduce stroke risk even more. This ongoing research shows that stroke prevention is becoming more precise and personalized. To sum up, research on statins has made them a key part of preventing strokes caused by clogged arteries. It has helped doctors understand how lowering bad cholesterol reduces stroke risk, but also how to balance this with potential risks. This knowledge has shaped guidelines and improved how we manage patients at risk for stroke. Always remember, if you are concerned about your stroke risk or cholesterol levels, talk to your healthcare provider to find the best plan for your individual health needs.